Hello everyone, this is Dr. Cui. So in this video, I would like to talk about another commonly asked question. Tell me about a patient encounter that has made an impact on you. So actually, for this, for this question, the answer is pretty similar to the question. Tell me about a touching story of you in in the clinic. So in order to answer it, we can tell the interviewer any story or experience we have in the clinic. It can be a touching story or any specific piece that make a difference in your life or your goals. So and also always remember to add a reflection at the end of each story. What the significance of your this experience and what you learned from this experience. So here's my example. Okay, Dr. Cui, can you share with me any specific patient encounter experience in your during your clinical rotation? Yes, definitely. So I remember when I was a resident doctor in China, I did I was in the rheumatology department, and that's a patient who is a 40 years old lady, and she is also from the same hometown as my father. So that's why I spend extra 5 minutes to talking to her each day. Yes, and that's one day. Her friend. I was on call in the evening, and her friend came to me and told me that the patient was crying. So she wanted me to have a look at her. So when I went there, I saw the patient squatting in the corner and face the wall and cry. That was crying out there. So I asked her if anything I can help you. And she told me that she just had a quarrel with her husband, and her husband threatened her to stop all of her medication treatment and force her to come home. So I told her that it's your decision to continue the treatment or not your husband. So no matter what decision you will make, I'm always here to support you. She seems feeling better, and after that, I finished the rotation in the rheumatology department and went to another department, and but I'm still caring of her. So I asked the new doctor who is in charge of the patient. After 1 week, I left the department, and I want to know what's going on with her. And the doctor told me that after the patient going home, she had another big quarrel with her husband, and then the patient just committed suicide. After knowing this, I felt so bad on that day, and I cannot imagine that. I was so astonished. So how can she do that? How can she make such a worst such a bad decision in her life? So after this story, I was thinking if her husband can control his mood, control his emotion, and won't fight with the patient. Probably the patient won't commit suicide. So so what I learned from this story is that I always try my best to control my mood whenever I have a bad emotion or something like that. So control our temper and always treat our families and the people we care about good. Don't convey those negative feelings or emotions to the people we love and to the patient. So that's what I learned from this experience. So you see that in this story, I told the interviewer one of my touching story, and also I shared my experience that what I learned from this story. Although the patient died, uh, um, I learned from it, and I will try all my best to take good care of my patient and my people and the people I loved and I cared. So that's my answer, and I hope you will also learn. I hope you will also get something from my story and will do very well in your interview. So good luck.